Excellent. This is a question for both of our hospital CEOs. This is from Danielle from Sugar Creek Township. What are hospitals doing to protect their workers, and when can we expect additional PPE supplies locally for our healthcare workers and first responders?
Yeah, so there is a lot of public information out there right now having to do with personal protective equipment that we call PPE, and there is a national shortage of it. A lot of it came out, or a lot of it does, if not most of it, comes out of China, and some of that supply chain was cut off for at least a period of time. So we're all in a rationing mode, but what I want to assure the community and the patients and the workers and our associates is that we have enough personal protective equipment to take care and do what is needed. We're going through different parts of our supply chain to be able to get that, and we ration it because we certainly have a lower supply, but that is getting better. I do want to give a shout out to just several individuals because they've helped with this. First of all, Dr. Christina Box at the Health Department of the state of Indiana. She's the doctor that's over the entire state. She's called me personally at 7 o'clock in the morning just to wonder how our health systems are doing. I've personally been reached out to by U.S. Senator Todd Young, U.S. Senator Braun, U.S. Representative Larry Bashan, State Senator John Ford, and State Rep Bob Heaton. They're all involved. They all want to know what they can do to help. There is a federal warehouse supply with this. It's being distributed to the states. In the states, we actually got a shipment from that just a couple of days ago. So they're watching over to make sure we do keep enough PPE. Nathan, do you have more for that?
Yeah, thanks, Steve. We're doing a lot of the same things that Steve mentioned for Union Hospital, but again, I think the acronym of the year is going to be PPE. We're very closely monitoring our inventory of all required PPE to make sure that we have adequate supplies. We do have adequate supplies. We don't have extra supplies, is the way we talk about it. And I think all health systems are doing that to make sure that they have the right supplies for the full duration of this pandemic, no matter how long that lasts. So that's things from monitoring your supply levels on a daily basis. We're spending a lot of time educating our frontline workers on the correct types of PPE to be wearing in certain situations. In certain cases, we're actually reprocessing PPE. So things like goggles and face shields, we're able to clean those and redeploy those back out to the floors to make sure we have an endless supply of things like that. We've also received some shipments from the Strategic National Stockpile, which have been very helpful and very beneficial. And as Steve mentioned, a lot of the federal and state government officials have reached out to us to ensure that we have adequate supplies. So the support is definitely there and definitely appreciated. But yeah, other than that, it's pretty much the same types of things, just making sure that we have the right equipment, that we're educating people on how to use it, and that we're being prudent with how we are using it so we don't run out.
I have something to add.
Our
EMA, Vigo County EMA, has been instrumental in coordinating the PPE push-out to EMS, to law enforcement, long-term care, ancillary care, the jail. And what they have done is looked at what we already had in place, and each time, along with donations and the Strategic National Stockpile, and being able to assess what's the greatest need. What all of those entities that I named have already in stock, what the anticipated need would be, and where's the greatest need. And so they've been very beneficial and have been working super hard in their cause to help us with the COVID-19.
Yeah, just a quick thing to add. Healthcare providers, and Dr. Patel can attest to this as well. We have educated ourselves tremendously about how to conserve our PPE within the hospital. That is our only defense against this. That's our frontline defense, as we're right there with these patients that are under investigation or presenting with signs and symptoms. And again, speaks to the issue with the N95 masks. And if people are finding them in their warehouses or wherever else, they need to go to the healthcare providers so that we can use those. And we certainly appreciate the donations that have come from corporate America our way as well, as with the supply lines through the hospitals and through the government.
Brendan mentioned earlier we have a very giving community, and through the chamber we witnessed the local contractors association stepping up and making some significant donations of those PPE. So, again, we do have a great community here, and happy to be part of it. So. Dr. Brecken, a question for you. Andrea from Riley, do you believe the coronavirus will die off during the summer months, and how strong of a possibility will it come back next fall or winter?
I think virologists actually believe this is going to be seasonal. We should get through through this first wave, if you want to call it that. It should lessen or dampen down through the hot summer months. It will be back this fall. Hopefully, we will have established what we term as herd immunity to some degree. It should not kill as many people, we'll put it that way. There still will be significant morbidity and mortality from this late into the fall. A lot like influenza, it can come back in the wintertime. We expect it to this year if it mirrors the SARS 2003 virus, which right now we think it probably will. It had a seasonal peak and then kind of died off, which is very encouraging. And of course, right now we are really pushing to get vaccines developed at a record, just a neck-breaking pace for that. Hopefully, we'll have something available. It likely will be 18 months to 24 months, so we will have a second surge, yes.
All right, thank you. Question for Dr. Patel. Another question from kind of the employer's side of things. We have several large manufacturers here in town, so if they have an employee on a shift who is showing signs but cannot be tested, what actions should they take regarding employees that may have come in contact with that person?
I think that's probably a better question for Joni.
Yeah, absolutely.
Read it to me again.
24, question 24.
right.
So if there is a employer that has an employee on a shift who is showing signs but doesn't necessarily meet those qualifications for being tested, what actions, beyond sending them home, what actions should they take regarding the employees that they may have come in contact with?
One, we would ask the person to self-quarantine, and again, it would go back to how close of a contact were they with the people, how long were they around them, but it would just be to monitor the situation and look to see if others are becoming ill.
And I would speak to that as well. If you're at a job in an essential role and you do fall ill, you can inform your employer, and that person needs to get home, number one. But we also don't have to jump to the conclusion that person has COVID-19. So we have to think they could have anything else. They could have bronchitis, just a common cold, even just a sore throat, because those things are still occurring as well. So we don't need to assume just because our coworker has gone home ill that they are stricken now with COVID-19 and hit the panic button within that community. We just have to be vigilant in observing how this plays out. But that person should immediately go home.
Okay. I'm going to jump around just a minute here. Dr. Bracken, I'll go ahead and send this question back to you. What is the best way to tell if you have the virus, pneumonia, or the flu?
A lot of the symptoms overlap. So as Dr. Patel touched on earlier, they're very vague and nondescript symptoms, but if people just generally don't feel well with malaise and not smelling well and sinus congestion and all of these things that can overlap with all of these conditions, they need to speak with their healthcare provider. Ask some questions via telephone because they're very simple questions to answer. If you get to the point where you're having difficulties in breathing, you feel like I've got to get some help, that should be your cue to get to the emergency room, seek EMS if we need to try to figure this out. You're not going to know until you get some sort of objective assessment from a healthcare provider.
Excellent. Joni, a question for you. This is from Constance. I've heard now is not the time to be getting groceries. Is this true? What steps can I take to protect myself if I do have to go out?
All right. We know that we have to have food, and we know that we have to go to the grocery store to get them. But is that trip to the store necessary? Are you going for a jar of spaghetti sauce, or are you going to get your items that you've predicted that you actually truly need? I went to Fresh Time yesterday. I made sure that I had on gloves, a mask, and I had my glasses on to protect my eyes. I got the items that I needed. I didn't fondle the stuff in produce or unnecessarily touch things if I didn't have to. I didn't take my cell phone with me. As soon as I got out into the car, I took off, or before I got into my car, I took my gloves off. I washed my hands with a Sani wipe. And then when I got home, I took my shoes off before I went into the house. And so just very hyper vigilant, very conscientious of what we're doing. But if you don't have to go to the grocery store, it's an unnecessary trip, don't go.
No, good advice.
And may add as well, maintain your social distancing.
Yes.
One of the mental cues that I have is I think that, I almost picture people walking towards me as though they're smoking. They're emitting this large plume of
Yes.
smoke around them, and I'm going to take an extra wide berth around them. The aisleways of grocery stores and really any type of public space are occupied by people all sharing the same air. So if you can limit your distance from people or expand your distance from people, that's certainly going to help. And being vigilant with hard surfaces. The other thing with going to the grocery store is please send one person
Yes.
from your family as your grocery store person. Don't send husband, wife, and 3 kids shopping. okay? Somebody, you just need one person to go get your groceries. I know several grocery stores around are also doing pickup service where you can just go and pop your trunk open and they'll come out and deliver it to you. It's a great service that keeps you out of the store, yet enables you to get your necessities that you need.
And some stores have certain hours for people that are elderly or have compromised immune systems. So be conscientious of those, and if you aren't those categories, try to stay away during that time frame.
Yeah. Kudos to our restaurants and retailers who have really shifted quickly to be able to serve people in a different way.
Absolutely.
Question for, again, Dr. Brucken. This is Becky from Sullivan. What are the chances people who were extremely sick during December and tested negative for everything had coronavirus?
This is it's an interesting question because I actually get posed to me quite a bit. We know this virus. We know where it started from was in Wuhan, China. We know roughly the timeline that it started. If it would have preceded and been here, we would have had a nidus of death like Wuhan had, where 3,700 people perished. So we know that's where it started. So if it precedes that or the nidus of infection that came through Washington State, that was the United States' first introduction of the virus as well. So you have to look at the timeline through there. Certainly there are people in this community that have been exposed to the virus and had very little or even no symptoms, and that has carried through internationally. People are shedding virus, they're getting exposed to the virus, they have no symptoms, they don't even know that they've had it. And that's, again, the cause and the plea. Keep yourself from shedding that virus asymptomatically. The numbers are staggering. Some of even the German studies suggesting even 50% of some of their studies are showing that people were asymptomatic. They had it and never knew it.
Wow. Yeah, interesting.
But that's a good point because that's where herd immunity comes from. Okay, so that's actually works to our benefit.
Dr. Patel, kind of going along with that, is testing available to check for those antibodies that exist after having the virus?
So currently not commercially available. The test, I want to be very clear, the test that we have now is a nasal swab. Some people liken it to poking your brain, but it tests for actual viral RNA. It's similar to DNA that shows that the virus is replicating. That is for active people that have recently been exposed and people that are currently or recently ill. The antibody testing is used to identify people that might have been exposed and have developed immunity. That testing is not yet here. It will be available. I personally know 3 healthcare providers in other cities that are contributing their own blood to help establish the titers because they have recovered from illness. So it is coming. That will be available down the road, and it will be an important test for us to truly understand the extent of this disease, as 50% of people could be completely asymptomatic.
Okay. Brendan, next question for you. We gave you this specifically because of your love of the outdoors.
Sure.
Is it safe to go mushroom hunting away from other people, and can the virus live outdoors in the woods?
Okay, and that's from Barbara, right?
That is from Barbara.
Okay, so Barbara, if you are watching right now, you need to text me the best locations for finding mushrooms right now because my wife is trying to find them where we normally go and they're just not there. But yeah, we were talking earlier about how many people are outside. I went home for a break this late afternoon. I ride my bicycle. I passed Mr. Holman 4 or 5 times. We live out in the same area. Joni's out there too, and the 3 of us have all talked. I have never seen so many people outside before in my life. That's good and that's bad. There's mixed messaging out there. We're being told to stay inside, and then we're told to do what? Go outside. Yeah. But I think the key thing here is stay away from somebody. If you're going mushroom hunting, first of all, you're going to do that by yourself anyway for the most part. But it's not the time to meet a new friend and go for a walk in the woods. Save that for when things balance out, and hopefully that's soon. But yeah, you want to get outside. You want to enjoy life. It's good for your mental health, and I'm not qualified to say any of this stuff other than I know that I'm dealing with this stress like all of us in here are, and my way of getting out and decompressing is going on the river. I haven't been able to do that, so I go out and try to enjoy what I can outside. So yes, go mushroom hunting, do what you can, be outside, clear your head in some form. As far as whether or not it lives outdoors in the woods, I have no idea. But since we're talking about mushrooms, make sure you know what mushroom you're picking. so that you don't get sick from a poisonous
It's a
mushroom.
whole
So-
nother set of problems.
Right.
But
So
what
let
are
one of the doctors
doctors
touch the other
address?
part.
Just a point of clarity, we're asking people to stay at home. That does not mean stay in your home. We're not trying to ground you like you're a 10-year-old who's in trouble. You don't have to go to your room and stay there. We want people to be outdoors around their homes. We want people to go for walks. We just want you to keep a comfortable distance from people. And if you're sick, that's not the time to invite your mother to go for a walk with you. Wear your mask. I know there was a question coming up, and I'll just touch on it now. Do we need to wear a mask outdoors? If you're going to be in a closed environment type of thing, if Dr. Patel and I are sitting on the back porch in opposite lawn chairs and we've got a nice cross breeze growing through, probably not. But if the breeze is taking all of my air right to Dr. Patel, it wouldn't be the greatest thing. So we need to be conscientious about that. So wearing a mask outdoors, particularly when you're in public, is a wonderful thing. Being outdoors is a wonderful thing because we're all dealing with the mental health strife of this. Okay, it does not escape anybody. So be outside with people. Just be responsible. Keep your gatherings to less than 10 people. Okay, because that really cuts down on crowding. Remember, the higher the level two of the common, or the higher the number of people, the more chances they have to congregate to a common place, whether that's a restroom or a kitchen countertop, or a cooler or whatever else. We have to keep that minimized right now.